if you look at photobiomodulation and the treatment of Parkinson's syndrome, like using red light therapy on the skull for neurogenic disorders and neuroinflammatory conditions, if you look at arthritic conditions, and all kinds of inflammatory pathologies in the body and the impact of photobiomodulation, it is astounding what light does in the human body.
A breakthrough happened in 2009. 10 patients with severe anxiety and depression received just one 8-minute treatment. 2 weeks later, 70% showed complete remission. The treatment? Shining red light on their foreheads.
Laying in red light therapy every day, if you do that for a month, even if you did it 10 minutes a day for 30 days, at the end of that month, you would notice a profound and material change in your performance.
Really?
Mm-hmm.
Now, cutting-edge research reveals red light doesn't just heal your skin, it rewires your brain chemistry. It reduces cortisol by 42%, increases serotonin levels naturally, and works faster than traditional therapy. Major hospitals are quietly incorporating this into psychiatric treatment. The results are so remarkable, researchers can't ignore them anymore. But here's what they're not telling you: the wrong wavelength could actually worsen anxiety. The anxiety epidemic nobody talks about. Anxiety disorders affect 40 million American adults each year. Traditional treatments have major limitations. Antidepressants take 6 to 8 weeks to work. Only 30% achieve remission, and side effects are often intolerable. What if there were a cellular-level approach that changes how your brain processes stress and anxiety? Something that works in minutes, not months. The brain-light connection breakthrough. Your brain cells can absorb light. When near-infrared light penetrates your skull, it triggers healing reactions. Red light therapy supercharges your neurons' mitochondria. This is measurable biochemistry, not mystical thinking. Studies show 810 to 830 nanometer wavelengths penetrate up to 4 centimeters into brain tissue. A breakthrough study found that stressed mice showed dramatic improvements when treated with near-infrared light. Their cortisol levels dropped 42%. Serotonin increased significantly. Anxiety behaviors nearly disappeared. The mechanism, red light, increases brain blood flow and oxygenation, reduces neuroinflammation, and enhances BDNF production, a protein that helps neurons grow and communicate. The clinical evidence that shocked researchers. In 2009, Massachusetts General Hospital researchers treated 10 patients with major depression and anxiety using transcranial photobiomodulation, shining near-infrared light on foreheads for 8 minutes. Results: 60% achieved depression remission, 70% achieved anxiety remission. Hamilton Anxiety Scale scores dropped 63% on average. Researchers measured actual brain blood flow changes using spectroscopy, documenting real improvements that correlated with symptom relief. Before we dive deeper into how this works, here's something exclusive. Juff, the leading medical-grade red light therapy company, is offering $50 off any device. These aren't toy devices, they're the same wavelengths and power densities used in clinical research. Unlike cheap knockoffs, Juve devices emit precise 810 to 850 nanometer wavelengths proven effective for neurological applications. The link is in the description. The wavelength precision that matters. For anxiety treatment, near-infrared wavelengths around 810 to 830 nanometers are crucial. These penetrate deeper than regular 660 nanometer red light, reaching brain regions involved in mood regulation. Clinical studies show 810 nanometers as optimal for neuropsychiatric applications, activating cytochrome C oxidase in brain cell mitochondria. Optimal power density: 250 milliwatts per square centimeter, with doses between 60 to 120 joules per session. The cortisol reduction breakthrough. Multiple studies show red light therapy dramatically reduces cortisol levels within single sessions. Researchers subjected mice to chronic stress, producing anxiety behaviors. When they received 810 nanometer photobiomodulation, cortisol normalized, serotonin increased, and anxiety disappeared. The optimal dose, 8 joules per square centimeter, produced maximum effects. Red light reduces pro-inflammatory cytokines, increases BDNF, and balances neurotransmitter systems. The Generalized Anxiety Disorder breakthrough. 15 GAD patients received 810 nanometer light to foreheads, 20 minutes per session, twice weekly for 8 weeks. Hamilton Anxiety Scale scores dropped from 17.27 to 8.47, moving patients from moderate anxiety to minimal symptoms. Benefits persisted weeks after treatment ended, suggesting lasting brain function changes. Treatment was well tolerated with no serious adverse events. Many reduced anxiety medications under medical supervision. The hospital revolution you haven't heard about. Major hospitals are quietly integrating red light therapy into psychiatric protocols. Patient demand drives 85% of complementary therapy adoption in hospitals. They want non-drug mental health approaches. UCSF now combines red light with cognitive behavioral therapy for treatment-resistant depression. Preliminary results show all but one patient no longer met criteria for major depressive disorder after combined treatment. The timing and protocol that works. Based on the clinical research, here's what appears to be the optimal protocol for anxiety treatment. Wavelength, 810 to 830 nanometers near infrared light power. Density, 250 milliwatts per square centimeter at the scalp surface. Dose, 60 to 120 joules per square centimeter per session. Duration, 15 to 20 minutes per session. Frequency, 2 to 3 times per week initially, then maintenance sessions. Target area, bilateral prefrontal cortex, forehead area. The key is consistency. Unlike pharmaceutical interventions that require daily dosing, photobiomodulation appears to create cumulative improvements with regular sessions spaced throughout the week. Many patients report initial improvements within 1 to 2 weeks, with optimal benefits emerging around 4 to 6 weeks of treatment. The effects appear to be sustained with maintenance sessions once or twice weekly. The limitations and realistic expectations. Let's be clear about what red light therapy can and cannot do for anxiety. It's not a magic cure that will instantly eliminate all anxiety disorders. Severe anxiety, especially with underlying trauma or complex medical conditions, requires comprehensive treatment. The research is still developing. Most studies have been small pilot trials. We need larger, randomized, controlled trials to establish definitive treatment protocols and identify which patients respond best. Red light therapy appears most effective for mild to moderate anxiety, especially when combined with other evidence-based treatments like therapy and lifestyle modifications. It's showing particular promise for anxiety related to chronic stress, mild depression, and sleep disturbances. The treatment requires consistency and patience. While some people report immediate effects, most see gradual improvements over weeks to months of regular treatment. The safety profile advantage. One of the most compelling aspects of red light therapy for anxiety is its safety profile. Unlike psychiatric medications, which can cause significant side effects, photobiomodulation has minimal risks when used properly. Clinical studies consistently report excellent tolerability. The most common side effects are mild and temporary slight fatigue immediately after treatment or mild headaches that resolve quickly. There are no known drug interactions, making it potentially suitable for people already taking anxiety medications. There's no risk of dependency or withdrawal symptoms, and there are no cognitive side effects like the emotional blunting some people experience with antidepressants. For people with darker skin tones, there may be slightly increased sensitivity to light therapy, but proper dosing protocols can accommodate this safely. The future of anxiety treatment. We're at the beginning of a revolution in mental health treatment. As our understanding of the brain-light connection deepens, we're discovering that many psychiatric conditions may respond to targeted photobiomodulation. Research is expanding into specific anxiety disorders, PTSD, social anxiety, and panic disorder. Early results suggest that different conditions may respond best to slightly different light protocols, opening the door to truly personalized light therapy. The technology is becoming more sophisticated and accessible. What once required expensive laboratory equipment is now available in portable, home-use devices that meet clinical research specifications. Can red light therapy help with anxiety? The emerging science says yes for many people when used correctly as part of a comprehensive approach to mental health. Red light therapy offers something unique in anxiety treatment. A non-invasive, side effect-free intervention that works at the cellular level to optimize brain function. It's not replacing traditional therapy or medication, but it may make them work better while providing an additional tool for managing anxiety. The key is understanding that this isn't alternative medicine anymore, it's evidence-based neuroscience. The mechanisms are well understood, the clinical results are promising, and the safety profile is excellent. Whether you're dealing with chronic stress, generalized anxiety, or just want to optimize your mental resilience, red light therapy represents an exciting new frontier in brain health. If you found this breakdown of red light therapy for anxiety helpful, smash that like button and subscribe for more cutting-edge health and wellness research. Hit the notification bell so you don't miss our upcoming video on light therapy for sleep optimization. Drop a comment below. Have you tried red light therapy for anxiety or stress? What's been your experience with traditional anxiety treatments? I read every comment and love hearing your stories. And don't forget that Jove, the leading medical-grade red light therapy company, is offering $50 off any device. Remember, mental health is just as important as physical health. If red light therapy can offer a safe, effective tool for managing anxiety, it deserves serious consideration and continued research. Thanks for watching, and here's to better mental health through science. Until next time, keep optimizing and stay curious.